Manual muscle testing video for the lower extremities.
When testing muscles, we have the patient meet our resistance and say, "Hold, don't let me move you." Manual muscle test grades are scored from 0 to 5. A 0 means there is no visible or palpable contraction. 1 means there's visible or palpable contraction with no motion. A 2 means there's full range of motion with gravity eliminated. 3 means there's full range of motion against gravity. 4 means there's full range of motion against gravity with moderate resistance. And 5 means there's full range of motion against gravity with maximal resistance.
To test the tibialis anterior, have the patient lay supine and dorsiflex their foot. Apply slight pressure to the top of the foot.
Anterior tibialis. Hold, don't let me move you. Good.
Tibialis posterior. To test this muscle, place a foot into inversion with plantar flexion of the ankle, and then apply pressure against the medial side and plantar surface of the foot in direction of dorsiflexion of the ankle and eversion of the foot. Posterior tibialis. Hold, don't let me move you. Good.
Tibularis longus. Place the foot into eversion with plantar flexion of the ankle. Apply pressure against the lateral border and plantar surface of the foot in direction of inversion of the foot and dorsiflexion of the ankle. Fibularis longus, also known as peroneus longus. Hold, don't let me move you. Good.
To test fibularis brevis, have the patient sitting or supine and apply pressure against the lateral border and plantar surface of the foot in the direction of inversion of the foot and dorsiflexion of the ankle. I'm going to be testing peroneus brevis, also known as fibularis brevis. So try to pull your toes towards your shin. Hold, don't let me move you. Good job.
To test the gastrocnemius, have the patient in long sit with the ankle in neutral. Apply pressure at the ball of the foot, trying to push it into dorsiflexion.
Okay, now we're going to be testing the gastrocnemius. You ready? Hold, don't let me move you. Good.
Test the semitendinosus and semimembranosus. Have patient seated. Place the foot into inversion. Apply pressure to the posterior distal calf.
Now testing semimembranosus and semitendinosus. So point your toe. Hold, don't let me move you. Good.
To test the bicep femoris, have the patient seated and evert the foot. Apply pressure to the back side of the calf.
Bicep femoris. Hold, don't let me move you. Good.
To test the iliopsoas, have the patient supine or seated and apply pressure against the anterior medial aspect of the leg in the direction of extension.
Iliopsoas. Lift up your leg. Hold, don't let me move you. Hold. Good job.
Rectus femoris. To test this muscle, place the knee joint into slight extension and put pressure against the leg above the ankle in the direction of flexion. Rectus femoris. Hold, don't let me move you. Good.
To test the vastus medialis, vastus intermedialis, and vastus lateralis, have the patient sitting and apply pressure to the distal anterior
We're
tip.
going to be testing the quads, which include the vastus medialis, vastus intermedialis, and vastus lateralis. Okay, hold, don't let me move you. Good. Plantar fascia lata. Place hip into flexion, leg into abduction. Apply pressure on the lateral side of the lower leg, hip into abduction and extension. Tensor fascia lata. Hold, don't let me move you. Good.
To test the gluteus minimus, have the patient side laying with bottom leg flexed, the top leg extended and abducted. Apply pressure towards adduction.
Now testing gluteus minimus. So I'm going to bring this leg back. Hold, don't let me move you. Good.
To test the gluteus maximus, have the person lay prone and extend their hip. Apply slight pressure to the back of the leg, trying to push them into hip flexion.
Next is the gluteus maximus. We're going to lift this up. Hold, don't let me move you. Good.
To test the gluteus medius, Place the hip into abduction with slight extension and slight external rotation. Apply pressure against the leg near the ankle in the direction of abduction and slight flexion. Gluteus medius. Hold, don't let me move you. Good.
Adductor magnus longus brevis. To test this, place the patient in a chair, knees flexed. Apply pressure against the medial aspect of the distal end of the thigh in the direction of abduction. Adductors magnus, longus, and brevis. Hold, don't let me move you. Good.
To test the sartorius, place the patient in lying supine with their hip flexed, externally rotated and abducted. Also have the knee flexed, and then apply pressure against the anterior lateral surface of the lower thigh in the direction of the hip extension, adduction, and medial rotation. Okay, we're going to be testing the sartorius. Okay. Hold, don't let me move you. Good.
Flexor hallucis longus. Put pressure against the plantar surface of the distal phalanx in direction of extension. Now testing the flexor hallucis longus. Hold, don't let me move you. Good.
Extensor hallucis longus. To test this muscle, place the MTP and IP joints of the great toe into extension. Apply pressure against the dorsal surface of the distal and proximal phalanges in direction of flexion. Alright, we're going to be testing the extensor hallucis longus. Hold, don't let me move you. Good.
To test the flexor digitorum longus, place the patient supine. Apply pressure against the plantar surface of the distal phalanx of digits 2 through 5 in direction of extension.
Flexor digitorum longus. Hold, don't let me move you. Hold. Good. To test extensor digitorum longus, have patient sitting or supine. Apply pressure against the dorsal surface of the 2nd through 5th toes in the direction of flexion. Extensor digitorum longus. Hold, don't let me move you.